السلام عليكم. اليوم حناخذ anatomy of the abdominal wall and the GIT viscera. طبعا هذه المحاضرة فيها تكرار من سنة ثانية. حنمر على كل شيء لكن التركيز حيكون على الأشياء الجديدة. هنا بداية as a conceptual overview, it's telling us that the abdomen starts where the thorax ends. طبعا احنا عارفين إنه the thorax ends at the inferior thoracic aperture اللي هو هذا و it's closed off by the diaphragm. فهنا that's where the abdomen is going to start and it's going to extend to the upper part of the pelvis and the lower limb. وطبعًا we know that it's a chamber with a single peritoneal cavity, which freely communicates with the pelvic cavity, meaning that it's continuous with it. فلمن we want to describe the inferior limits, we have both the superficial and deep limits. Superficially, it's going to be the superior margin of the lower limb, اللي هو where the leg starts. And then deep, we have the pelvic inlet, اللي هو هذا. بعدين, the abdomen consists of wall and space that forms the cavity. Hina, the wall is mostly going to be muscle, unlike the thorax, that's mostly bone. Hina, it's mostly going to be muscle, as you can see in the image. يعني. In terms of the skeletal elements, عندنا the 5 lumbar vertebrae with their vertebral discs, عندنا the superior expanded parts of the pelvic bones, and the bony components of the inferior thoracic walls, اللي هي rib 12, rib 11, the xiphoid process, and the costal margin. Hina, we know that the muscles of the abdominal wall are divided into 3 groups: posterior group, lateral group, and anterior group. Posterior عندنا quadratus lumborum, iliacus major, والiliacus. Laterally عندنا transversus abdominis, the internal oblique and the external obliques. بعدين anteriorly عندنا rectus abdominis on both sides, which extends from the inferior thoracic wall all the way to the pelvis. بعدين السوالف هذه كلها هنا, it's basically saying that the abdomen is connected all together from the back, sides, and front. The back is joined by a thick fascia. The sides and the front are joined by flat tendinous sheets اللي هي الأبونeurosis جاية من lateral muscles. وبعدين we also have a fascia between the wall and the peritoneum inside. هنا, the arrangement of the abdominal viscera اللي هي organs in the adult, they depend on the embryological origins. هذه السوالف كلها, they're basically saying that the early gut hangs in the body by 2 folds. تمام. عندنا dorsal mesentery and the ventral mesentery. طبعا the dorsal mesentery is a lot larger than the ventral mesentery. طيب, these mesenteries, they're يعني عبارة عن folds of the peritoneum. They're both attached to the diaphragm at the top. وبعدين, what determines the adult organ positions is the growth, rotation, and fusion of the gut to the body wall. The peritoneal cavity, as we know, is the space between the parietal and visceral peritoneum. وعلى هذا الأساس, we can classify organs as either intraperitoneal or retroperitoneal. Intraperitoneal organs, راح تكون أوضح في هذه الصور, they're inside the cavity and they are hanging by the mesentery. لكن retroperitoneal organs are going to be behind the cavity زي كذا. طيب, هنا it's just repetition. They're examples of the abdominal viscera. With functional significance, we know that it's to move the trunk, to house and protect the abdominal viscera. وبعدين we have a few, يعني عندنا عمليات تعتمد على intra-abdominal pressure اللي هي breathing, الفلاتس اللي هو الجاس, الفيسيس, الفيتس, اليورين and vomitus, كل هذه تعتمد على intra-abdominal pressure. هنا نجي لشيء جديد يعني. We divide the abdomen into quadrants and regions على أساس إنه we locate pain or organs easily. يعني مثلا إذا قلنا we have pain in the right lower quadrant, we can يعني conclude that it's for the appendix. أو ممكن we guess يعني. المهم إنه هنا الدكتورة نبهت إنه we have to be aware that sometimes in the answer choices we might have answers that are both correct, بس لازم نركز إذا هم طالبين الريجن ولا الكوادرنت. طيب, بالنسبة للabdominal quadrants, it's going to be divided into 4 from its name. وعندنا the right upper quadrant, left upper quadrant, right lower quadrant, و left lower quadrant. طبعا هذه it's not as accurate as the regions. بس هنا يعني we were told that we need to know which region is associated with each type of pathology. مثلا the pain in the right iliac اللي هي that's for the regions حنشرحها دحين. It's going to be for the appendix. يعني نحفظها عشان تكون clinical based. We know where the pain is being localized. طيب, فهنا for the regions, we're going to have 2 planes. We're going to have the subcostal plane and the intertubercular plane. على أساس the tubercles of the iliac bones. فلما نقسمها we're gonna end up with 9 regions total. عندنا the right hypochondriac and the left hypochondriac. هذه طبعا مسمينها hypochondriac because they're under the cartilage of the ribs. عندنا right and left lumbar because of the lumbar vertebra, and then we have the right and left iliac because of the iliac crests on the hip bones. بعدين في النص عندنا umbilical region because that's where the navel is, and then we also have the hypogastric region, it's under the stomach, وبعدين epigastric above the stomach. طبعًا أغلب التركيز كان على ال right iliac region، ماني متأكدة إذا كلها حفظ، لكن it will help you solve clinical questions I'm assuming. طيب هذه هنا مكررة، هنا اختصار يعني I couldn't find a really good mnemonic for it، بس المهم هنا إنه the superficial fascia is divided into 2 layers. عندنا الcampers والscarpas، it's a little more clear in this picture. برضه هنا نفس الشيء. طيب هنا مو واضح الكلام، بس essentially the important thing is that we have natural lines of cleavage. فلما مثلا we want to do a surgery, we want to go along these lines as much as possible so that healing is as fast as possible. طيب هنا برضو we have a clinical application, the attachment of the membranous layer. هنا scarpus fascia is going to change its name depending on where it is. فit's going to become Buck's fascia وبعدين Cole's fascia. هنا the main clinical application, when the urethra tears or ruptures, urine or blood can leak under the scarpus fascia. طيب it's going to spread over the region كله, but it can't go to the thighs because the fascia is tightly attached to the fascia lata. المهم إنه the swelling that goes on here اللي هو accumulation of either the urine or the blood, it's going to accumulate and give us a butterfly appearance, which is why it's called a butterfly appearance. طيب هنا ممكن تقروها, it's mainly review, بس يعني what I found ما كان مكتوب فوق. الcarpus fascia continues as Darto's fascia in men and the labia majora in women. Scarpus fascia fuses with the fascia lata اللي هو الفاشيا في الثigh, and it continues as Cole's fascia. وهنا نجي للnerve supply. طبعا برضه مكررة. It's easier to يعني تفهموها على الصورة. فهنا it's going to be from T7 to L1, it's going to supply the wall muscles themselves and the parietal peritoneum. بس بالنهاية they're going to supply the skin. So from T7 to T9, it's going to supply this region اللي هو from the xiphoid process just above the umbilicus. T10 زي ما احنا عارفين is going to be the umbilical region. وبعدين T11 all the way down to L1 is going to be the umbilicus to the pubis region. وبعدين عندنا L1, it has an additional branch اللي هو ilioinguinal nerve. It's going to supply the anterior surface of the scrotum or the labia majora in women and sends a small cutaneous branch to the thigh. طيب هنا هذا جديد. The nerve supply to the abdominal viscera themselves اللي هي the organs, it's going to be the sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. طيب أول شيء for sympathetic innervation, it's going to be from T5 to L2. And the function here is that it's going to inhibit peristalsis and it's going to constrict the blood vessels and convey visceral pain. طبعا زي ما احنا عارفين we have fight or flight and rest and digest. هنا sympathetic is going to be fight or flight. But in this case we're not going to be digesting, which is why peristalsis is inhibited. وزي ما احنا عارفين it constricts the blood vessels. وهنا يعني معلومة إضافية إنه it conveys visceral pain. But for parasympathetic innervation, it's going to be rest and digest. So we have the nerves coming from the vagus, we have the vagus nerve and we have the pelvic splanchnic nerves. طبعا the vagus is going to be supplying the foregut and the midgut, whereas the pelvic splanchnic nerves are going to be supplying the hindgut. The pelvic splanchnic nerves are going to be from S2 to S4. وبعدين the function here is going to be stimulating peristalsis زي ما قلنا, rest and digest, and secretion. وطبعا هنا it's just saying that we can't really localize pain in the viscera, so ممكن we have referred pain. هذه الصورة, it's just showing us that the ganglia of the sympathetic nervous system are near the spinal cord, whereas the ganglia of the parasympathetic nervous system are near the viscera. طيب هذه أخذناها بالphysiology. It's essentially saying that the enteric nervous system also يعني يتحكم في GI tract. عندنا submucosal plexus اللي هو Meissner's plexus and the myenteric or Auerbach's plexus. Submucosal is going to control secretion, so S for S, and myenteric is going to be between the muscle layers اللي هي circular and longitudinal, and it's going to mainly control motility and peristalsis. But for the blood supply, we're going to go through the wall itself and the viscera. لكن الصور هنا أوضح شوية. طيب superficially نبغى يعني نقسمها أول شيء. عندنا superficial و deep supply. Superficially, the upper part is mainly going to be from the musculophrenic nerve اللي هو a branch of the internal thoracic. يعني كده. وبعدين for the lower part, it's mainly going to be the femoral artery. عندنا ال superficial epigastric artery جاية كده هنا, so it's medial. And we also have the superficial circumflex iliac artery اللي جاية كده هنا, it's going to be lateral. And then for deep supply عندنا ال superior epigastric from the upper half اللي هو بالنهاية it's also a branch of the internal thoracic. بعدين for lateral عندنا ال 10th and 11th intercostal plus the subcostal اللي هي جاية كده. عندنا for lower the external iliac artery. Medially we have the inferior epigastric. Laterally we have the deep circumflex artery جاية كده. طيب بعدين عندنا next the blood supply of the abdominal viscera themselves. هنا it's going to be based on the three major branches of the abdominal aorta. فطبعا عندنا هنا the foregut is going to be supplied by the celiac artery. عندنا the midgut is going to be supplied by the superior mesenteric artery. the hindgut is going to be the inferior mesenteric artery. طيب بالنسبة للبلد supply this is just يعني repetition. طيب venous drainage يعني it's saying that the spleen, the pancreas, the gallbladder or the abdominal part of the GI tract ما عدا inferior part of the rectum is going to be through the portal system. طيب it's going to go through the portal system and then it's going to go to the liver and the hepatic sinusoids, then it's going to go through the hepatic veins and eventually it's going to drain into the inferior vena cava. طيب هذه برضه مكررة. The venous drainage of the anterior abdominal wall. عندنا سؤال where do the systemic and portal veins meet. فدحين حنشرحها. أول شيء for venous drainage, the above the umbilicus is going to be the lateral thoracic vein, which goes through the axillary vein. Below it is going to be the superficial epigastric vein, and that's going to go to the femoral vein. وبعدين عندنا هنا it's like a clinical application. عندنا this is called caput medusa. ما أدري if I'm pronouncing it right. بس المهم إنه هذه زمان she was like in Greek mythology she had snakes coming out of her head. That's why like they named it that. This is caused by portal hypertension or liver cirrhosis. فيصير في backflow through the umbilical veins. بعدين هنا في نقطة مهمة. It's telling you a few small veins اللي هي the para-umbilical veins connect the network through the umbilicus along the ligamentum teres to the portal vein. This is what forms an important portacaval systemic venous anastomosis اللي هو the response to this question over here. طيب يعني عشان يكون بشكل أوضح, the small para-umbilical veins اللي هي the veins around the umbilicus, they link the veins around the umbilicus to the portal vein through the ligamentum teres. يعني this ligament is what's going to be the structure tying it together, which causes the anastomosis. طيب بالنسبة lymphatic drainage, عندنا superficial lymphatics are going to accompany the subcutaneous arteries. Above the umbilicus is going to go to the anterior axillary lymph nodes. Below it's going to be the superficial inguinal nodes. Rather than the deep is going to accompany the deep vessels draining into the internal thoracic, external iliac, posterior mediastinal, and para-aortic lumbar nodes. طيب هذه النقطة مهمة. بالنسبة للlymphatic drainage, we already know the arteries, like the arterial supply. طيب أخذناها إنه the foregut is supplied by the celiac, midgut by the superior mesenteric, and the hindgut by the inferior mesenteric. فهنا يعني بكل بساطة it's going to drain into the corresponding lymph node. إيش معناتها؟ معناتها إنه مثلا the foregut is supplied by the celiac artery, صح? So it's going to drain into the celiac nodes. وعندنا midgut is going to drain into the superior mesenteric nodes. بعدين inferior mesenteric nodes they're going to be the شو اسمه the hindgut is what's going to be draining into there. طيب surface landmarks عندنا xiphoid process, الcostal margin, الiliac crest اللي هو هنا, وعندنا anterior superior iliac spine. هذه ممكن يعني نحفظها. I'm not sure if it's super important بس الدكتورة مرت عليها يعني. هنا clinical significance is that we can feel things through it اللي هو الabdomen. وبرضو abdominal incisions, we have lots of different types of incisions depending on يعني مثلا what procedure we want to do. clinical conditions هذه قراية برضو. هنا ال laparoscopic incisions يقول لك إنه we basically make small incisions to insert trocars for cameras or instruments. فأول شيء we make one small incision near the umbilicus and we place the camera in it. But then we have 3 to 4 incisions in the lower abdomen and we place instruments in it. وبعدين we inflate the abdomen with CO2. With this يعني هذا يفيدنا because the CO2 creates space. We can see the organs in a better way. The CO2 is also easily absorbable and we can exhale it through the lungs, so it's safe. هنا عندنا الabdominal hernias هذه أخذناها. It's going to يعني it's essentially a protrusion of the viscera يعني في مكان غلط. uh, واللي بعدها direct and indirect inguinal hernias. عندنا هذه برضو مكررة من الترم اللي فات بس this picture from first aid is really helpful for that. أول شيء نحدد is it inguinal ولا femoral. فطبعا inguinal is going to be related to the inguinal canal. Femoral أساسا حيكون below the inguinal ligament يعني ما له علاقة. It's going to be near يعني the femoral. uh, it's going to be near the thigh assassin, and it's more common in females. Hina, when we want to differentiate between direct and indirect, indirect is going to protrude through both the deep and superficial rings, whereas direct is only going to go through the superficial ring اللي هو هنا. وبعدين حاطين like a mnemonic عندهم MDs don't lie, so medial to the inferior epigastric vessels is going to be direct hernia, whereas lateral to the inferior epigastric vessels is going to be indirect. فهنا عندنا the inferior epigastric vessels, medial is going to be direct, lateral is going to be indirect. طيب وآخر شيء عندنا external versus internal hernias. هنا external is going to be a visible bulge, شيء نقدر نشوفه, و it's going to push through the abdominal wall. هنا it's more dangerous because there's no visible bulge and the viscera are going to slip through defects inside the peritoneal cavity اللي هي يا mesentery or the peritoneal folds, for example.